So presumably I just start, do I?
Yeah, that's right, whenever you're ready.
Okay.
Hello, my name is Annabelle and I'm 7 years old, and I'd like to know what inspired you to become a specialist in respiratory viruses.
Hi, Annabelle. Well, that's one of my favourite questions, and it's a question I get asked a lot when people find out what I do for a job. So the reason I became interested in respiratory viruses and wanted to really highlight them as being really important causes of disease in people is because when I started virology 20 years ago, we weren't diagnosing them very well or very quickly, and people kind of forgot about them. And so I wanted to show that not only were they important, that we could diagnose them much quicker and be able to treat them and look after patients better with them. And as you can see, we're currently in a pandemic caused by a respiratory virus. So I think I was right to go down that path.
Hello, Dr. Moore. My name's Edward and I'm age 8. And my question is, will you have to have the vaccine every year, and how long will it last? Thank you.
Hi, Edward. That's another question that I'm being asked quite a lot about. So will we have to have the vaccine every year? Well, we don't know that yet, and it sort of matches with the second part of your question, because we don't know how long our immune response is going to be to the vaccine. So it could be for 6 months, it could be for a year, it could be for even longer. We just don't know that yet. But what we have to factor into this is not just the way our immune response is to the virus, but also to the virus itself. So you're probably seeing in the news that there are lots of variants and different types of this virus that seem to be coming out from different parts of the world. And what we're worried about is, as the virus changes, is that the parts of the virus that we recognize, we don't recognize them so well. And so what we're able to do then is just to modify the virus, the vaccine just slightly, so that the next time we get a boost, the year after or 2 years after or 3 years after, depending on how long it takes for the virus to change and for our immune response to last, we might need to have another dose of vaccine just to boost and to protect for what currently that virus looks like to our immune system. I hope that answers the question reasonably well for you. But basically, if you just look at something online about the influenza vaccine, you'll see that we change that every year. So it could be that we do something similar to that.
Hello, Dr Catherine Moore. My name's Nalid. I'm age 7, and my question is, what was your favourite subject at school? Thank you.
Hi, Nalid. That's another really good question. So my favourite subject was actually history, because I like everything about what's happened in the past, and I always think that you can learn about everything that goes on nowadays from learning from what happened in the past. And as a scientist, I often look backwards to help me to go forward. So history, funnily enough, was my favourite subject. Thank you for your question.
Hello, my name is Katie Burton and I'm 11 years old. My question is, how do the different coronavirus vaccines work?
Hi, Katie. That's a really great question. Okay, so how do they work? Well, they both work in exactly the same way. So here is a virus. This is actually my stress toy, but it looks like a virus because it has spikes on the outside. I think you can probably see that. Well, when we become infected with the virus, it's these spikes on the outside that our immune response recognizes first. So all of the antibodies and the bits that protect us from infection target or kill the virus by sticking to these and stopping the virus from working. So what happens with the vaccine is the two types that are used in the UK at the moment. We have one vaccine called the Oxford vaccine, And that is a virus, another type of virus, which is non-infectious. It doesn't cause disease in us. And what they've done is very cleverly put the piece of the genetic parts of the SARS virus inside it, which just basically make that spike protein on the outside of the virus. So that gets injected into our arm, and our own cells take that piece of genetic material and we make that spike protein, and our immune response recognizes that. So that's called, in science terms, that's called the antigen. So our antibodies are made towards the spike antigen. And so that means that when we meet this virus again in real life, we've already got the antibodies present that we hope will meet the virus, stick to the outside and stop that virus from causing us disease. And not just that, so the second vaccine is even cleverer, I think. So they've taken away that sort of vessel which carries the genetic material in, and they're just injecting the genetic material which makes that spike protein directly into our arms. And so our cells just make this spike protein just from the genetic material. And it's just really clever. And so what we produce is lots and lots of this spike protein. Our immune response is made to that. And so going forwards, should we meet somebody who has the infection and they cough and we become infected with this, our immune response immediately recognizes that outside bit, and the rest of the virus can't do anything because we've what we call neutralized it, we've killed it. I hope that explains it. It's a very, very complex thing to explain, but I hope that sort of lets you know what happens with the vaccine. But they both work the same way.
Hi, I am Zach and I am 6. How many known viruses are there in the world?
Hi, Zach. You've asked the impossible question. How many known viruses are there in the world? Well, viruses can infect anything that has a cell. So a cell is the smallest part of our body. So it makes up all of our tissues and our skin, for example. So plants can be infected by viruses. Fish can be infected by viruses, even bacteria, so the smallest things which cause infection, they can be infected by viruses. So because we have lots and lots of viruses that exist in the world, the easiest way that we can actually look at viruses is by looking at what makes them all very similar. So we divide viruses into families, a bit like your family. So everything which is similar in your family, so it might be they all have the same hair color, they all have the same eye color, they all like eating cheese, you know, that kind of thing. We classify viruses in that way. So that's what we call it, a classification. So at the moment, there are 168 families of virus in the world. And so that means, though, but you know that your family probably has lots of members in it. So grandparents, parents, mum, dad, cousins, all of those belong to families. So the chances are that there are probably as many viruses as there are stars in the sky, but we've divided them very neatly into about 168 families. So that's probably as much as I'm going to be able to tell you at the moment. I hope that's okay.
Hello, my name is Sebastian and I'm 9 years old. And my question is, will we have to live with COVID-19 forever?
Hi, Sebastian. Thank you for your question. And that's a question that I think everybody is asking now. Are we going to have to live with this virus forever? And I think I have to be really honest with you, because I think we probably will. And there are lots of reasons for that. All the way through human existence, we've had to live with pandemics of viruses, and more often than not, those viruses that start a pandemic eventually become part of our normal seasonal virus repertoire, or population that live with us all through into the future, essentially. And so although we have things like vaccines coming on board, the chances are that, we can vaccinate one part of the population, but whilst this virus exists anywhere in the world, there's always an opportunity for that virus to be reintroduced into areas where perhaps we've immunized. Now, please don't feel scared about this, because normally what happens when these viruses become part of our normal population of viruses that exist alongside of us is that we learn to adapt to them, and that the diseases that we get become less severe, and that we don't see so much of the severe end of the diseases that we're hearing about in the news at the moment. And you're hearing about lots of things about the way the virus is changing and variants emerging, and half of that sort of process is to allow the virus as well to live with us. And so it's a long going process, but I suspect, unfortunately, we're not likely to see the end of this virus anytime soon. So even if we only have to live with it in the short space, it may be that 10 years down the line, we may have better vaccines that can actually eliminate or get rid of this virus completely. But it's going to take some time. So yes, I think we probably will end up having to live with this for some time, and possibly forever.
Hi, my name's Erin. I'm 6 years old. My favourite scientist is Marie Curie. Who's your favourite scientist?
Hi, Erin. That's a really good question. So who is my favourite scientist? So you've chosen Marie Curie, who is a very famous lady scientist, and her discoveries helps us cure cancer nowadays. But I've thought about this a lot, about who my favourite scientist might be, and I'm actually going to go for somebody who influenced me and my career, and that is one of my university lecturers, and her name is Professor Rose Cooper, and she taught me microbiology in university and really inspired me into going into microbiology as a field, and her specialist subject was looking at honey and using honey to stop infections, and certainly sort of infections that had been with people for a long time. But she was very kind, she was very knowledgeable and very enthusiastic, and she really helped me choose the career path that I'm in now.
Hello, my name is Lily. I am 6 years old. Will children ever have the coronavirus injection?
Hi, Lily. That's another good question. So will children ever have the coronavirus injection? So you're probably seeing on the news, and you may have older relatives who have had the injection. And at the moment, we're not giving this to children yet. And you're probably wondering why that is, because I suspect you've probably had a vaccination, an injection, a squirt up the nose to stop you from getting influenza. Well, at the moment, these vaccines are very, very new, and none of them yet have been tried on children. So we don't know whether or not children will respond as well as adults do. And at the moment, they're in quite short supply. So we have to make sure that people who are very, very vulnerable, so that is people who will become very sick should they get the coronavirus infection, have the opportunity to have the vaccines first. Because strangely, we know that most children, even though they could potentially get a coronavirus infection, don't seem to have very severe disease at all. They don't get very sick. So what you might have is a little bit of a cold, or you might have no symptoms at all. But so generally at the moment, we're not looking at giving children the injection. That doesn't mean that we won't. We may, in about a year or two's time, decide that children do need to have the injection, and we'll let you know about that. But at the moment, we're just concentrating on those people that we know will be very sick if they get coronavirus. So that's the older people who have conditions like cancer, and also people who we know are going to be exposed to the virus. So that is, they work in an environment or in a place like a hospital where they're going to be treating people who have coronavirus infection. So not at the moment, but that doesn't mean it's never going to happen.
Hi, my name is Katie and I am 8. I would like to know why you got interested into science, Dr. Moore.
Hi Katie, another good question. So why did I get into science? And you heard earlier, I'm sure that my favourite subject at school was history. So how did I go to science from history, you might ask? Well, the reason was I was really curious and I really wanted to know how I could answer some of the difficult questions that I was often thinking about. And I learned that science was a good way of doing this, that I could learn how to answer questions by doing experiments and doing research. And it wasn't just a case of reading books. I could actually get involved and learn for myself. And as you can see, sort of, I'm still in science now from when I was very young, and I really enjoy what I do, and I'm glad I went down that path. Thank you for your question.
Hello, my name is Reese and I'm 5 3/4. I love dinosaurs, and do you know how big a Gigantosaurus egg is?
Hi Reese. Now that is a really good question for somebody who likes dinosaurs like you, but I don't really know that much about them. I'm not an expert in dinosaurs. So what I know about the Gigantosaurus is that they're similar to the Tyrannosaurus Rex, but a little bit bigger, but they're not quite as big as a Spinosaurus. Now, I've had a look and I've asked a couple of friends about what they know about the eggs of these dinosaurs, and apparently they haven't found any eggs. So we can only really guess that they were very big. So I'm sorry that I can't really answer your question this time, but I think if I can find an expert, I might be able to the next time we speak. I hope that's okay.